My name is Dr. Jody Stanislaw. I'm a type 1 diabetes specialist. I have had type 1 myself since 1980. And I'm here with fellow type 1 Jason today, who has worked with me, gone through my program, been in my group calls. And I just wanted to introduce everybody watching to Jason and have him share with you his experience of working with me. So first of all, I just want to say thank you, Jason, for taking this time to let me interview you.
You're welcome. Yeah, thank you for all you've done for so many people.
Well, thank you so much. Thank you so much. So, Jason, so how long have you had type 1 and where are you calling from?
I have had type 1 for 15 years, January of 07, and I am calling in from North Dakota. Almost on the Canadian border, so extreme North Dakota. And yeah, so it was January of 07 when I was diagnosed.
Okay. And so what was your diabetes life like before you found me and my programs?
Thinking about that, the word that comes to mind is autopilot. I was just sort of, here's what the doctor said, and you do that, and there wasn't a lot of thought that went into it, or planning, or other resources. It was just, here's your dose, here's what you should be taking and doing. One of the other things, maybe at the very beginning, I was doing more of the finger sticks, and then as time went on, it less and less, so it was just kind of an autopilot and not much care going into it.
And how were your numbers back then?
I don't remember exact numbers, but I'm sure it must have been high. After meals. It was a little bit difficult to know because I wasn't doing as much.
That's so common. And Jason, your story is so common because most type 1s are given what I call, half or a quarter of the textbook that we really need in order to thrive, right? There's so much education that type 1s need that most type 1s aren't getting, which in my opinion, you now have, right? So how is your diabetes in your life better now that you've been through my 3-month private program and my monthly group calls?
After, I guess, a little backstory before doing the calls with you and the program, I did start using a CGM in shortly before I joined on working with you. But really, after working with you, it was taking much more control, more thought with the meals, with exercise, just, okay, where are my levels after this meal or going into this meal? So there was much more control. And that comes from, a lot of it stemmed, once I had the CGM, I saw what was happening, like after a meal, 2 hours or whatever. And so that spurred me on to a greater desire of managing it better.
And it seems like right after you got the CGM or pretty close to that is when you found my program. Is that accurate?
Yes, I forget exactly on the internet of all the things where I came across. But yeah, I was looking up different type 1 stuff on the internet and came across probably some of your YouTube videos, and especially some of the ones that dealt with exercise and type 1 is what spoke to me and how to manage it better.
Yes, Jason and I both love to ride our bikes. And so I have a lot of videos of me managing my blood sugar while riding my bike. So that must have been maybe one of them. So what are 3 blood sugar management tools that have really changed your life that you've learned from me?
Yeah, I did jot a few things down just so I'm not cheating here or whatever.
Okay.
But Probably the biggest one, or I guess they're not really in any specific order, but one of them would be pre-dosing. Uh, Really, but when I was given my first instructions after diagnosis, it was okay, take X number of units, X number of times a day, just like 3 times a day with your meal, and that was it.
With no
And
flexibility, no
right,
consideration of adjustments. Yeah.
yep. So pre-dosing, also like then that leads into split dosing, or that I might need multiple shots for this meal, not just one shot.
Mm-hmm.
So those two things, and then maybe like you just mentioned, the bike riding, the exercise in managing the type 1 has been probably one of the uh, biggest achievements for me that you've given me, is just how to go out for a bike ride and maintain your blood sugar, not having to eat a bunch right before you go, or going low. So
That's took me 20 years to learn. So I'm so happy when I get to teach that and give that information to people. Yeah, because most of us are taught just stuff your face before you exercise, right? So I did that for 20 years before I figured out it's all about how to know how to dose your insulin properly, right? It's such
yeah.
a good tool to know. So to take the best pearl, what do you like most about learning from me?
I think it was, again, seeing some of your content that you had on the internet. It was that you have lived it and have tried it. And one of the things you've talked about is, running all these other experiments, even on your own
Yeah.
management of type 1. So I think just seeing that openness and boldness and courage to, hey, I'm going to try this, or whether it's food or exercise and dosing, those kind of things. So just that gave me courage and confidence to have another type 1 demonstrating that and living it and showing that.
Yes, that I'm so glad. I'm so glad that you've taken that pearl and that lesson, because I think it makes living with type 1 so much easier. I don't like to use the word easy because I don't think type 1 is easy, but more manageable when we have more of an open mind to, well, I should try this, I should try that, right? I just talked with a patient yesterday. She eats the same thing every day and she's afraid to ever not eat that same thing. And she doesn't want to go out. She doesn't want to go out to meals, to friends. And my goal is to help her be a little bit more open-minded, and so that the fact that you've picked up on that and now you can have more flexibility. I know you do a lot of socializing in your life. And so that's such an important tool. And I'm so glad you've gained that.
Yeah, thank you. That's been one of the just having a greater courage with managing the type 1 has been a great insight.
Awesome. Awesome. 2 more questions. Did you have concerns? I mean, I'm just like this naturopathic doctor online, right? And so some people might think, I don't know, who is she? So did you have concerns before you signed up to work with me? And how did you get over them? Because obviously you got over them.
Yeah, it was, I would say, yeah, I did have some concerns, or just like, well, how do I do this? Or, I would say the whole online course thing was new to me.
Yeah.
Working with someone, through the internet was not something I had done before with anything else. So
Yeah.
that was kind of a hurdle. And then I think it was right in the midst of COVID, or it was right at the beginning that we started meeting. And so what sort of got me over that hurdle was just, again, I had the CGM, and I said, I want to be able to manage this better. And it was just put these fears to rest. I need to take the steps to do this. And so your courses and your online offerings spoke to me and offered that help that I needed.
Great. Great. Well, Jason, it's been an absolute pleasure having you in my program and on our group calls. And I thank you so much for taking the time to share your experience today. it's such a gift. There's so many type 1s out there that needs more support, and maybe they are where you were, where they want support but don't know, should I trust this lady, right?
Yeah, I would say too, part of it was there was just never anything else offered to me, like through the doctor's offices. It was just, well, maybe you could go see a dietitian again.
Yeah.
And but also some of it was, I don't know this for sure, but none of them were type 1s themselves. And so again, I think it was your witness as saying, hey, I've been living this, and I can help you with a type 1. So
Yes, that's so true. So true. Well, thank you so much, Jason, for sharing your experience. And for any of you that are considering working with me, please, you can always reach out on my website, which is drjodynd.com. That's N as in naturopathic, D as in doctor.com. Or you can just Google the words Dr. Jody Diabetes and everything comes up. My YouTube, my Facebook, my website. And like Jason said, I have online courses. I have a private program. I have coaches now that I've just hired to expand my reach. And I have a membership program. So I have lots of offerings. And I'm sure if you're type 1 and you're struggling, one of them will be a great fit for you. So you can always send me an email at info@drjodynd.com. So it's info@drjodynd.com. So thanks for watching, and thank you so much for your time, Jason. I appreciate you sharing your experience with everybody.
yeah, I'm glad to. And thank you again for all of your help.
Absolutely. Okay. Thanks for watching. Bye for now.